Hi, I'm Naisha McCauley, and you're watching AccessTV.org.
Good morning, and welcome to Everything is Health. I'm Dr. Helen Newton, your host on this program. Each week, we will travel to a different area of Connecticut and interview the movers and the shakers, those people who are working very hard to help eliminate disparity in the state of Connecticut. Today, we are at the Curtis D. Robinson Men's Health Institute, also the Center for Health Equity. With me in the studio today is Dr. Marcus McKinney. Mr. Curtis Robinson is here, and at the end, we're going to take a walking tour through the Men's Health Institute. Good morning, Dr. McKinney, and welcome to Everything is Health. Let's get started. Tell us about Mark McKinney, the man. Who are you?
Well, I'm a fella that lived in different parts of the country, came into Connecticut some 32 years ago, did my training at a couple different hospitals, and landed right here at St. Francis Hospital. Married a nurse from one of our units, and so Valerie and I have brought up a family, and I've been blessed to be called to the work for all these 30 years in this community of Hartford. That's a very diverse community, and frankly, an institution with people like Curtis Robinson and others that allowed me to just be creative. Yes. And hear the needs and respond to needs of folks who are around us here. So it's a wonderful place to work.
Excellent. Now, the first time I actually heard about you, it was in connection to the pastoral care ministry that you do at St. Francis Hospital. Right. Can you tell us a little bit about that?
I would love to. A number of years ago, it became apparent that we had a lot of folks who were doing marvelous, what we might call counseling with a small c. They weren't diagnosing anyone, but they were handling and helping with the problems of life. I'm talking about Sunday school teachers and secretaries and shelter counselors and a number of people. But a lot of them didn't have the education required to get them into a master's degree or sit for a license. And I kept wondering, why don't we help these folks do what they're already called to do better? Yes. Worked with the state of Connecticut Department of Mental Health and Addiction Services with then Deputy Commissioner Tom Kirk, now Commissioner Pat Reamer, who are visionaries. And they saw the value of this back in the 90s. So we've had 6,500 people, if you can imagine that, come through our classes. And the only requirement is that this not be simply an academic endeavor, that you really are helping people between classes. So there'll be a number that people can call if they'd like to know more about that pastoral counseling class. pastoralcounselingtraining.com will get you that information as well. But we're really trying to empower people. Almost everything we do in this hospital, including the pastoral counseling program, is aimed toward empowering and helping people where they are. Whether they have lots of resources or no resources, we want to make sure they can be have a full life.
Oh, that's very important. Now, are the services free?
The services for the pastoral counseling program, yes, are underwritten primarily by the state of Connecticut at this time. We've had the blessing of having most of that covered. There is a student fee that, depending on which class you're taking, might be $100 or $200, but I stress, no one's refused for inability to pay. So if someone's listening to this and says, gee, I'm not sure I could pay for this, we especially welcome you in a confidential and hopefully dignified manner so that everyone gets to take the class. If you're really doing frontline work, we want you there. And
what are the services that your graduates provide to the community?
It's a wonderful cross-section of how people help. Some of them are giving women's ministry groups that they run about dealing with the problems of life. Some of them are dealing with divorce issues in groups or seeing someone individually tonight at 7 o'clock without the need for filling out a whole bunch of insurance papers. And again, not diagnosing, but really more informed in how do we collaborate, refer to other professionals if needed, and really make an assessment yourself, because you and I will know there are a lot of those Sunday school teachers that are giving pretty good counsel, and we need to affirm that. So they're all through the walks of life. I mean, we had last semester a PhD faculty in psychology from UConn sitting beside a secretary of a church. from an African American church in Hartford. That's not uncommon for our classes. They are, by the way, very diverse. So more than half of our 6,500 folks are from communities of color. We celebrate that. I can't explain to you how that happens, except it's a lot of word of mouth, which I kind of like. But we think that diversity makes it deeper and richer.
Wonderful. So we're at the Men's Institute. How did you first meet Curtis Robinson?
Well, Curtis, I should say, long before we officially met, Curtis actually lived in the house next to where my wife grew up in South Windsor. So even before we officially met, there was almost a destiny that I think we would come together. And indeed, one day, a number of years ago, maybe 5 or 6 years ago, with Curtis joining the board, he had a great passion that a mutual friend of ours, Jeff Steinberg, a surgeon, joined with him on. And the hospital got behind his vision, which was really, we should take down barriers for anyone, virtually in any way we can as an institution, to have access to health care. He specifically had a passion for what he had experienced in his life with prostate cancer. He'll talk about that. But I think that's how I met him, and I realized he was a board member, but he was and this counts a lot in my book, and that is he was a person of the community. He loved the community. And so he was willing to give his time, which I would say for a businessman of his stature was worth a whole lot to me, to be in the community, and he still does that to this day.
Yes. So you are currently the vice president at St. Francis Hospital, and that is for community health equity.
Right.
So what, in terms of St. Francis Hospital, have you had any involvement at all with the class standards?
Yes, the class standards are part of an overall strategy that we are trying to build into our institution to do a couple of big things. One, to not only provide kind of appropriate language services and other cultural services, but also have a platform. So I would say to you that the St. Francis Center for Health Equity, really inspired by the Curtis D. Robinson Men's Health Institute, has really said we not only need to do programmatic things, but we need a platform of individuals that are committed in their career, multicultural team of about 10 folks now, with a number of resources that we can access in the hospital, with a site that's planted wonderfully in the Urban League of Greater Hartford. That platform has two big approaches. One, into the community, to know the community better. Now, Dr. Newton, I know the community pretty well, but there's always a lot more for me to learn. So we are forever getting into the community, providing services and learning more every time we do it. I don't think we'd have done that without a platform to engage the community in what I would consider a very sophisticated agenda to learn more and then help change the second part of what we do, and that is help nurses and doctors and clinicians of every kind, housekeeping and dietary, become more culturally and linguistically responsive to this wonderful, diverse community. You know what? They love to do that anyway because many of our employees are coming from this community. But we felt like the platform would help support both sides of this, the community and practitioners.
Well, on behalf of the Commission on Health Equity, we are looking forward to St. Francis participating in the class standards as part of the approach to eliminating disparities in health.
Absolutely.
In health in the state of Connecticut.
Absolutely. And we appreciate that leadership because that's core. That is core. The class standards that have been revised are core to what metrics we need to be measuring to say, did we go out into the community and we try to change the system? Do we know we've made any difference?
Right.
So thank you.
Do you think that St. Francis would be able to take the lead in that charge in terms of incorporating these standards in everyday practice?
I believe absolutely, and I believe our commitment to spend honorable resources for this platform and this team is the beginning of the testimony, but I would love to be such close partners, Dr. Newton, that we hold each other accountable for that partnership and collaboration that will make a difference.
Well, you've said two of the great words, collaboration and partnership, and we will reach out to you and we'll do everything we can to work together to make that a possibility. St. Francis Center for Health Equity is dedicated to servicing our community for optimal health through education, research, and engagement. In what ways have you accomplished this, And how have you advanced health equity in this state?
We could talk about several of those, but let me try to be very concise here. In research, we have engaged now 5 clear-cut active research programs right now. An example would be cervical cancer. Turns out that if we study, which is sometimes not done in hospitals, but we've really embarked on studying our data. That is, what is the patient experience for certain, broken down by ethnic groups or income or other areas? What are we learning where either the kind of care chosen by the clinical team or the access to care, when did it happen? If a woman has cervical cancer, does she come in, if she's of a certain income or race, does she come in at a later stage? And we're now drilling down the data to get a better snapshot. Not to be punitive or blame anyone, but to say, we know across this country there are disparities. What we don't always know is there data to support the dimensions of that disparity? And then secondly, which is really, really important, what do we do about that? Do we know enough to actually change care? And I spoke with our CEO, Chris Stadlitz, who deserves a lot of credit for the kind of resources invested here. I spoke with him initially and said, if we're not going to change care, but just going to have more information, I'm not interested. So I think it's important when you hear Curtis that you're dealing with frontline people, people that are the tires hitting the road. That research will do that. Community engagement, Dr. Newton's the same way. We can say, oh, we engage the community, and we think of a lecture being given to a shelter or a church or something. But the truth is, to really engage me in the community, I'm going to need to know your name. Yes. I want you to know more about me and maybe my family and the struggle keeping lights on my street. You know, that's the kind of community engagement that is actually more sophisticated than simply a poster. And I will tell you, we are just passionately committed to make sure community engagement and the research we're doing, and frankly, the collection and use of data makes its way to changing and giving better care. And that is to attain better health optimally for everybody. The last thing I would say is we have an eye on something here, I say, for our group. Two big things. Okay. Always be teachable. So our team has to always learn something new. I don't care if you're teaching wonderful things that somebody doesn't know about blood pressure. We should never walk away from engaging an individual or a group without learning something. But also, we should have a spirit that we're actually going to always engage the community, that focus group insight from the community is not an added plus, it's an essential core. And historically, places have not always done that. So I think we're committed to making sure that is a priority.
We thank you so much for your remarks today and your participation as VP at St. Francis Hospital. We feel will make a great impact in the direction of eliminating disparities in the state. We thank you for today, and we look forward to working with you in the future.
Thank you.
We'll now bring on, thank you again. We'll now bring on Mr. Curtis D. Robinson. now with Mr. Curtis D. Robinson at the Curtis D. Robinson Men's Institute, Center for Health Equity. Mr. Robinson, how are you today?
Good, very good. Doctor, how are you?
Good, thank you.
Yeah.
We'd just like to start right in by asking you a little bit about yourself. Who is Curtis D. Robinson, the man?
Well, Curtis D. Robinson is a guy who left Birmingham, Alabama at a very early age and migrated up, actually we thought it was north, but actually it's east, to Connecticut when I was a young teenager. And I subsequently I got off the wrong bus. I thought I was going to Boston, and the bus stopped in Hartford, and everybody got off the bus. And I asked the guy what part of Boston I was in, because I got off the bus as well. And he said, no, you got to go another 100 miles. And I said, I tried to get back on the same bus, and the bus had left. So I said, well, you know, I don't know anybody in Boston. I might as well try this Hartford, Connecticut. So I subsequently slept in the park, in Bushnell Park, that one night. And the next night I got a job washing dishes at this new hotel that they was building. And a gentleman there, I told him my story, and he gave me a room. And a gentleman died about 15 years ago, which I supported him. And I worked 2 jobs until I was 18, saved a little money, and bought a grocery store over on Capon Street in Hartford. And I guess you can say the rest is history. When I was 22, I bought the building, and subsequently I was fortunate enough to acquire some additional properties. And when I was 35, I bought the hotel, the same one that I washed dishes. It was interesting. Everybody used to ask me, Mr. Robinson, how do you know how to fix a dishwasher when it breaks? I didn't tell them I was there when they put it in, you know. But that's how I, you know, got to Connecticut. Subsequently married. You heard the wonderful Dr. McCauley. His wife was actually born and raised next to my home in South Windsor, and I was fortunate enough to, you know, do a lot of things in terms of business in the city of Hartford. It wasn't done when I was a young child. But in 1997, I went to get a normal checkup, and the doctor looked at my PSA, and it was elevated. And he came back and said, we need to do a biopsy. It's something here that is not normal. And after the biopsy, they found out I had prostate cancer. And they removed the prostate, and I'm glad to say, you know, I'm cancer-free today. Around 5 years ago, as Dr. McCauley, who's a wonderful man, who I love very much, who's been just, you're talking about Batman and Robin. He's my Robin, and I noticed a disproportion of men who was in our emergency room who had the blood in their urine and elevated PSAs. Mm-hmm. And I asked Dr. Steinberg, who was the chair of surgery at that time, why was that? And he said, well, 2 reasons. 1, men don't like to go to doctors, as you know. And 2, a lot of them is embarrassed because they don't have insurance. Yes. And the only time that St. Francis would see those men, it would be pretty much in the emergency room when it's kind of too late, that the cancer now escaped out of the prostate and in the lymph nodes. And it's not too much you can do for them at that point. So I said, how do you stop that? He said, well, the only way we can stop it, we have to set up some type of institute that we can go out to churches, mosques, synagogues, libraries, wherever men's gather. Mm-hmm. And he said, if we can do, you know, perform these tests, that we could, you know, stop it before it had a chance to spread out of the lymph node, the prostate. Right. So with that, I called my dear friend, Dr. McCauley, who was our pastoral counselor at St. Francis, and asked him could he get the churches involved. And I would say within 10 days, he had at least 25 or 30 ministers in our boardroom. And Dr. Steinberg explained the disproportion of specifically African-American men who was entering our emergency room with elevated PSAs. Mm-hmm. And that they allow us to come in their churches and do these blood tests on Saturday and Sunday mornings. And I figured maybe a half a dozen would sign up, but all 30 of those churches signed up. And with that, we set up the Men's Health Institute. And what we have done since that time, we have tested over 4,000 men as of today, and we've saved approximately 42 of them who would have died.
That is fantastic, and we can only thank you for putting a face to this disease and by bringing it to the forefront of people in the community. Now, Mr. Robinson, I want to ask you a question. You know, they have this saying that hindsight is 20/20. When you look back on your diagnosis and treatment, do you feel that there may have been signs or symptoms that you may have overlooked before you were diagnosed with prostate cancer? You know, for some reason.
Yes. Well, one of the symptoms is constant urination. If you find yourself getting up in the middle of the night, going to the bathroom 2 or 3 times, as well as when you start to urinate, if it's delay in starting it, then you should get checked. I did not really know that African American men die disproportionately to Caucasian men.
Yes.
Give you an example. My PSA was like 4.7 when I had my prostate taken out. Caucasian could have a PSA of 7 or 8, and it will not, you know, be a death sentence for them. This is why we have engaged Tuskegee Institute. We formed a joint venture with them, with their pathology department, Dr. Yates. They were having problems getting tissue, pretty much tissue from African American men to the University of Alabama, Birmingham. They could get tissue, but it didn't specifically say what type of tissue. So what we have done through Dr. McCauley, we have provided them with thousands of samples of tissue. With that, my understanding that Dr. Yates now have found a marker that separates African American cancer from any other cancer. Now, there's not a cure, but there is a marker. And we don't know, Dr. Newton, if it came, I think they traced it back to West Africa. And we don't know if it was a lack of vitamin D, because we're not really used to the cold weather, so we don't get as much. And I think in certain parts of the world that have darker skinned people, it's less prominent. Well, we have prostate cancer, but it's not as deadly as the ones that we have here in America.
In terms of the difference in diagnosis and treatment between African American men and Caucasian men, do you think access to care and or poverty play a role in the mortality rates that we see in African American men? Absolutely,
absolutely. I mean, it's prevalent because you know, I find that even with sickle cell anemia, that it's not being researched as other diseases. I find that anything, and this is why I think access to insurance now is going to be very, very helpful, because people now will start doing researches in things that have not been done in past because there was no economic reason for that. Unfortunately, it's not right. That's why I embrace our president's, Chris Statler, for taking the lead on this and said, no more. This has to stop. And regardless of a person's race or economic situation, we must stop this. We are a mission-driven religious hospital, and we have a duty to do this. The Sisters of Valente, who started this hospital 100 years ago on our connecting street, took people off the street. And they took care of them for nothing, and that's our mission today. I mean, we can't do it for, we have to, but the thing is that our mission is to not focus on the fact that income or race or anything else is the first priority before we engage in taking care of these patients.
Yes. So we all know that you gave $1 million to St. Francis Hospital to actually found the Men's Institute and this center.
Yes.
What was your vision at the time that you did that? What did you have in mind?
Well, the thing is that when I talked to Dr. Steinberg, Dr. Steinberg said, Curtis, we need to do this, but we also need funds to do this. He said, I will do the operations for free, but I also work for St. Francis. And he said we would need hopefully another Da Vinci machine. We had one Da Vinci machine, and said we need another Da Vinci machine. And that if we can get another Da Vinci machine, I can encourage some of my other fellow surgeons to also participate in doing these operations. So, you know, I went home and I talked to my wife. I said, you know, we have to do this. We have to do this because, you know, one of the guys at one of the radio stations asked me and said, Mr. Robinson, why did you give $1 million to get this thing to the hospital? I said, well, let me ask you a question. If someone was laying next to you dying, what would you do? Would you say, me and my wife, we worked all our life for this money? What would you do? And what would you say to God? When God said you could have saved him.
That's right.
But you know, you wanted a bigger house, a bigger car. You could have saved him. I don't want to have that conversation with God. I can't save anyone. I can't save everyone. But we've saved 42 of them. And now we have access to health care, which was not there before. And our former Archbishop Mandrell said to me, you know, Curtis, you've done such a good job, as well as Chris Dallas. He said, you know, because we were funding these things ourselves. And he said, no more. This is what the hospital should do. This is our mission statement, and this is what we will do. So I got to give Chris Dallas and Archbishop Mandrell, they have picked up this cause.
Wonderful. Every soul is valuable in the eyes of the Lord.
Absolutely.
And so your work will not go unrewarded. I'm going to ask you now, Mr. Robinson, if you would take us on a tour of the Men's Health Institute.
Absolutely.
Thank you.
At Hartford Public Schools, we care about one thing above all, the future of our kids. That's why we're dedicated to providing all students with the knowledge and skills needed in the new global culture. Hartford Public Schools is thriving. More student success stories, more world-class facilities, more university and corporate partnerships, more amazing talent coming and staying in Hartford. This is how education is supposed to work. Welcome to Hartford Public Schools, where the future is present.
Mr. Robinson, I see that you have met President Obama.
Absolutely. President Obama and I had an opportunity. I had an opportunity to meet him with my wife and my grandchild down in Palm Beach about 1.5 years ago. And we talked about prostate cancer, and we talked about disparities, and we talked about the lack of insurance for men who was dying with prostate cancer. And he said that's one of the reasons why he was driven to make sure everybody had access to insurance. He said that prostate cancer is one of the most curable cancer if you catch it in time. And that was one of the things that he really focused on. He really thanked me. In fact, he was here a couple of weeks ago at one of the universities, and I was surprised that he remembered me because, you know, a lot of time when people are running for elections, they won't remember you, but after the election, if they remember you, then that's something. But he did remember me. He remembered the fact that we raised him a lot of money down in Palm Beach, and he thanked me for what we're doing. And he said in an interview, in which I was very, very proud to hear him say that if you don't have access to capital, Mr. Robinson, you will die. And I thought that was something coming from the President of the United States. I was very proud to hear him honor the fact that I've tried to give back and save some men's lives, and was recognized by the highest person in the world.
And we understand that in 2010, that President Obama himself named September National Prostate Awareness Month.
That's correct.
Excellent.
That's correct. And what he was doing, trying to encourage men to go out and get tested, because once you catch the cancer, you can pretty much treat it. But if you don't catch it in time, then it could be catastrophic. So what he encouraged for the month of September for every man, regardless of what nationality, you know, to go out and really get tested for prostate cancer. especially if you're over a certain age. I mean, they encourage African Americans to get tested at 40, Caucasian at 50. Unfortunately, if we have a relative, a blood relative, say a father, uncle, or brother who have prostate cancer, then you got like an 85% chance of having it. I have 2 brothers. I'm the youngest. Both of my brothers have prostate cancer. If you look at our former mayor, Thurman Milner, he has 7 brothers. They all had prostate cancer. For some reason, it's in the genes, and we don't know why. But if you have a blood relative who has prostate cancer, then you must get it, especially African American at an early age. But we encourage everybody to get tested, regardless of whatever ethnic group that they belong to.
Thank you. So, Mr. Robinson, can you please take us on a tour? We want to see your center.
This is our receptionist and waiting room, and we encourage people from the community to come in at any time that they are in the area, or they just want to just come in and meet with some wonderful people here who would greet them. It's one thing about this St. Francis Hospital. You don't have to worry about insurance. You don't have to worry about people looking at you like, well, you know, you shouldn't be here. They will greet you just as if you was, you know, the President of the United States. Everybody who walks through this door, and as long as I'm on the board, that will always happen. We treat everybody the same, and hopefully we treat them well. If not, they can always get in touch with me.
Okay, you heard that.
This is a medical consultant room, where when you come in, Dr. Diaz, and Dr. Murphy, one is our primary care physicians, and the other one is a urologist. So you can come in at any time and meet with them. Just call up and make an appointment. If you think that you're having some discomfort, just call up and our receptionist will make an appointment that you can just come in and see them at any time, and we'll make arrangements for that.
Okay, so are the patients actually examined here, or do they go someplace else for the exam?
The assessment is kind of done here.
Okay.
So the first visit to be able to see what the person might be interested in receiving or need. And then depending on the outcome of that assessment, they might be done here or might be done in one of our many clinics. That's why this assessment becomes important. Curtis and I talk a lot about, many of us men, we need a stopping station like this to get comfortable with what even the question is. And so this platform, this place we have here that looks a little like a clinic, but also a little like a person's living room or an educational setting, is designed to make it comfortable for people to make a better assessment. So our doctors come over here to make sure that happens. Wonderful,
wonderful. Wonderful. That's very, very important, that it's comfortable and it's private.
That's right.
Right.
And this is simply one of our staff, Stacey Ann Walker, who's joined us and is probably here somewhere, but she's a MPH, that is a public health expert, a woman who's really got a great track record at helping lead the initiatives we're talking about, which needs to straddle kind of public health knowledge, plus a compassion and concern to actually meet with folks and make a difference that we talked about earlier, and Stacey's office is here. This is where we have lots of interns and folks that support us. Shirley Moonchilds, Dr. Moonchilds is a wonderful part of our staff. And come over and say hello.
Be my pleasure.
And she's been with us for a while. I've known her for many, many years. She's well known in Hartford. And tell us a little about what you do.
As a member of this team here, I am assisting and advocating for all the patients, other members in the community, and all of the care that they need, whatever it may be, just to be assured that they are getting what we call equitable treatment.
Excellent.
She's out on the road a lot, meeting in churches and homes and every place you can imagine. And with her here are often interns. We get lots of residents, interns, students of many kinds, and public health students, but frankly, ministry students, lots of folks who we engage and embrace to help them learn what we're doing in the community and be part of their education.
Excellent, excellent.
Adriana and Sarah are both what I would consider the nerve center. They're the two folks that, talk about in first impressions, how important they are. You'll meet these two fine ladies when you come to 140 Woodland and seek our center team out. are the Institute, and you'll meet them, and they'll be able to direct you, answer questions, and with a compassionate and informed approach, be able to get you where you need to be. I find this is extremely important, not only because of the paperwork and other things they do, but because people need to feel comfortable. All of us know what that's like. If we don't feel comfortable, it doesn't matter what happens beyond this desk. So that's my promotion for how important you folks are. It's nice to have you all here.
All right.
Yeah.
So we're talking about one.
Now we have meetings going on in here.
What you want to, is it Stacy?
Stacy is here that we mentioned,
Stacy and Mary.
and Mary, who's
right.
our director of our Center for Health Equity.
Hello, nice to meet you.
Come on out.
Come on out, say hello.
So what do you do here with the
I'm
Men's
the
Institute?
Programs Operations Coordinator, and I work with the Curtis D. Robinson Men's Health Institute and the Center for Health Equity, and just community benefit. As a tax-exempt hospital, we have to document all the good work that we do in the community, and we have to keep a record of that. So that's one of the projects that I work on. And for last year, it was to the tune of $89 million that St. Francis contributed to the community in the greater Hartford area. So we're very proud of that.
That's
So that's
wonderful.
just one of the projects and initiatives that I work on.
Great, great. And
What?
Mary, come out.
Good to see you again.
Yes. Yes.
That's what
Yes.
you do.
I'm the director of the Center for Health Equity.
And how long have you been the director here? And
for-
tell us a little bit about your day-to-day activities.
Okay, so let's see. We moved into this building a year ago in January, and I sort of was in the position a little bit before that, trying to pull things together and craft a center. And my day-to-day activities are pretty varied. Right now, Stacey Ann and I were just working on a project around language services
Yes,
and trying to improve the access to language services throughout the hospital.
right. So that sounds like class standards. Is that part of it?
Yes.
Okay,
exactly,
good,
right,
good,
exactly,
good.
yeah. So that's kind of an important issue in terms of health equity. I mean,
Yes.
if you can't communicate, then you're not going to get
Right.
the service that you need.
Right.
So that's a big piece. And then we do a fair amount of work sort of educating doctors and individuals in the hospital to understand health equity,
Yes.
and also to hear from them about the challenges in providing care to the community. And then we do a lot of work in the community, hear from them about the challenges that they have in accessing healthcare. So that's another piece of my work. I do the supervision, I do the boring budgeting things. And grant writing, grant administration, and then sort of strategic planning and overview and where we're going to be in 5 years, that kind
Okay.
of stuff.
Can you share a little bit about where you envision the center in 5 years?
Yeah, well, you can talk to Curtis, we're going to own the whole building.
Yes. Well, I think we expanded it. We brought, even though it's called the Men Health
Yes.
Institute, but we take care of anyone who walks
Okay.
through those doors, whether you're a male or female. And I think we're going to broaden that. We're talking about that now in terms of which directions we're going to go in, because you got African American women and you got white women and you got Hispanic women who's also poor.
Yes.
And also there's a disparity there as well.
Yes.
So we're going to try to bridge that gap with
Fantastic.
with that group as well.
And that actually is that's a good piece of another thing that's sort of on our agenda currently is that this expansion, and then also connecting to other areas of the hospital that are already doing some of this work,
Yes.
right? So we know that the Women's Heart Program has a strong presence and is doing a good job. And so if we can connect with them and hold an event where women and men are showing up together, and we're talking about heart disease broadly, and we're talking about healthcare broadly, then hopefully that will give us more inroads.
And maybe just one more thought here. One of the most important things I think we probably keep in the front of our minds is that we have these wonderful experts and specialists in the hospital who would love to know better how to engage the community. That is, they'd like to know where they could go, where more people who aren't presently getting care could have a conversation. And that could actually raise the likelihood someone's actually going to feel comfortable getting care. So our job is to really increase that connection and relationship. So we're constantly straddling, getting in the community, and then arranging for this half of our space here dedicated to community engagement. Classrooms where we're bringing community folks in and letting them ask some tough questions of our interested physicians and nurses. And to me, that's where we must head. Population-based management, in a more kind or more appropriate expression, would be just community engagement.
Yes.
That is, we want to engage a population, a community, and help them inform how to get better care to our physicians, and I think they want the same thing.
And that's what I like about the class standards. It's a continuous process of community engagement, improvement, and then starting all over again, going back to see what do we do
That's right.
next to make a change. And I think at the end of the day, that's what this is all about. And that's making a change to improve the quality of health for all people in the state.
Perfect, absolutely.
I mean, I think the other big piece about that is, you know, when we talk about engagement, we're talking about learning as much as we are
Yes.
teaching. And, you know, that sort of exchange of, I have as much to learn from you as you do from me, likely more. And that sort of humility that you bring to this work and your willingness to recognize that in spite of the office and the titles, that really that's not what it's about. It's more about hearing what people have to say and recognizing that together we can sort of make a change that facilitates success and better outcomes, really, better health outcomes for everyone.
Absolutely. Absolutely. That's what we're looking for at the end of the
the end
very end of the day.
Right.
It's about the community and about
Absolutely.
the people that we serve. And so often in the past they have been excluded from the equation.
Yes.
So we are very happy to hear this, and it's about time
Yeah.
that
Yes.
the community that's being served is actually included in, you know, the whole process from beginning to end.
I mean, I think
Yes.
your comment too about the fact that it's very, you know, the way the class standards are designed so that you keep going back. You know,
Yes.
that iterative approach is, it's long and slow, but it's critical.
It's critical.
You know, it's not something that happens in a linear, straightforward fashion. You
No.
know, it's 16 conversations before you sort of finally say, that's what you're talking about. Okay, I hear you.
Right.
And
So-
equity really for us is equal valuing.
Yes.
So that means any of us could say in any given day that we're speaking with somebody, we're not sure they really value us the way they do somebody who has more money or more titles or more whatever. Our goal is to really be sensitive to that. And so we start that here.
Yes.
To make sure that we have an attitude that says, you know, equally valuing is something we have to work at. It doesn't just happen normally in our culture.
Right.
So that's health equity.
And you said a very important word, it's equality also, because
Yes.
the word now, the terminology for this decade is equity,
Right.
but the end point is equality.
There you go.
And so we
Absolutely.
can never take our eyes off of the end point, which is equality for all people. This is the process to get us there.
Absolutely.
Okay, thank you.
So you have more offices this way,
We're staff here.
more staff,
Critical
wonderful.
staff.
And who do we have here?
Michelle?
Hi, how are you?
Say hello, tell us.
Hi,
Hi,
nice
how
meeting
are
you.
you?
I'm Michelle.
Good,
Nice meeting you. I'm
good.
the outreach coordinator.
Outreach
Yes.
person.
Can you tell us a little bit about what you do here at the Institute?
Sure. What I do is I keep a relationship with the community about our center, informing them what we can do for them, and basically building that trust relationship that they need, and letting them know that at the hospital they can feel safe to come here, get their needs met, and at the same time have someone to speak the language that they cannot speak, the fear that they may have, help them to break that barrier and get the trusting relationship with the physicians here at the hospital. That's what I do.
That's that's wonderful. Do you actually accompany any patients that might be very nervous about going over to the hospital?
Yes, what I do is when I go in the community, I introduce the programs that we have.
Yes.
Like the Courtesy Robinson Men's Health Institute, our prostate cancer program. I meet with them, let them know about our program, and I work closely with the nurse navigator, Rebecca Santiago, to ensure that they are screened either at the site that they're at or within the hospital itself. They do come here. When they are screened, they will get their screening done here. It's a 2-portion screening where they get their blood drawn. I'm there with Rebecca, and sometimes I draw the blood too, and then Rebecca and I actually walk them over to the walk-in clinic at Gengras where they meet with Dr. Luis Diaz Morales, who does the other part of screening.
Right.
And through that process, I'm walking with them, I'm talking to them about our resources, I'm letting them know that we're here to help them, and I'm asking them any questions that has to do with their family and their health, just to see if I connect them in any other kind of way.
So
that's
you
what I do.
are you a phlebotomist?
I am also a phlebotomist.
Oh,
yes.
wonderful.
Yes.
So you
So-
provide a great
Triple threat.
service.
Yes, yes, yes.
It does
Good.
all, and relationships are critical to what she does.
Yes.
We all benefit from the fact that long before we meet a lot of folks, she's met them.
Yes.
And then she builds that relationship that allows people to feel comfortable
Yes.
getting any kind of care. Wonderful.
Yeah, definitely.
And Rebecca Santiago is our in-house nurse. She's out today, but she's pretty much the language barrier. She's been very helpful in that. And what I've done, which, you know, I've demanded that all our emergency room be bilingual 24 hours a day, because it's very difficult when you come in, you can't speak the language, you have symptoms that you can't explain.
Exactly.
So St. Francis always have someone in the hospital, regardless of what nationality they are, that they could speak their language. And Rebecca is one of those. She's wonderful in that. You might want to talk to them about what we do on a weekly basis in terms of going out to the community
Sure.
and testing.
What we do on a weekly basis is that we go out, we provide an informational presentation, and also opportunity for any individual, any man in the community to be screened. I connect with various sites, shelters, housing authorities, soup kitchens, even if the faith-based organizations. And I schedule time that we go out there, Rebecca and I, and also the physician, will go out there and do an hour presentation where we educate them about the screening itself and about our services and our program. And then we give them the decision to be screened. And when they do take the screening opportunity, we also open it for them to ask about any health in general. And what's really good about Rebecca as a nurse navigator is that not only does she offer screening, but she also checks for blood pressure, diabetes, anything that is also going on with them to connect them to the right places. And sometimes we do find men who actually have high blood pressure and consider it as a nonchalant thing. It's just something about a part of their life. But what she has done to take initiatives to connect them with the emergency room and connect them with Dr. Diaz to get screened to take care of their health. And one thing that's really good about Rebecca and Dr. Diaz being Hispanic and of the Latino background is that we provide our presentations in both English and Spanish. So we're really connecting with them. We're going out of our realm and going into their world. And so that's what we really take pride in, and we love that. And we're going to continue doing that. We're going to continue assessing the community and seeing what they want and make it a part of our mission to make sure that they are taken care of. So that's what I do.
Right. You mentioned homeless shelters. When you go out, if someone needs transportation to come here, do you provide transportation?
We do not provide transportation, but we do connect with the ACS and other services that do provide transportation. That is one thing that we do, is that whatever we can't do, we find someone who can do it. And we make sure we have that relationship with them. So that way someone is never dropped at any point in time.
Perfect.
I'll tell you a little story quickly. We were doing a homeless shelter over on Albany Avenue, and we had a photographer there, and the gentleman, PSA, came back very elevated, and he had no address, so we couldn't find him. So we took his picture, and we went down Albany Avenue and Main Street and Park Street until we found him. We found him, and we brought him in, and we operated on him. And after we operated on him, we had our human services to get him an apartment, and now we also employ him now at St. Francis. He works in our facilities department. He's back home with his family, and he's doing really well. That's one of the things at St. Francis, one of our many stories.
That's a real everyday success story. That's wonderful. Reuniting families.
Absolutely.
Yes. Okay, thank you so much. We appreciate that.
Here's
Lawrence Young.
Lawrence, did you come out and...
Come on.
Lawrence is
Lawrence is a real gift for us.
He's one of our fellows.
Under the Connecticut Health Foundation, we had the opportunity to search the entire country for someone who could join our team and be a health equity fellow. That is somebody who's really well into their career with a master's in public health and really versed with his great experience in Atlanta. And now he's joined our team with us for at least 2 years. Tell us about what you do, Lawrence.
Hello. Well, right now I'm working with a grant primarily with African American men, looking at their use of primary care and some of their barriers to primary care and primary care seeking behaviors, and also some enablers. What are some factors as family lives, spouses, family members that promote them to go to the doctor, because we want to definitely promote that whole relationship with primary care providers.
Wonderful. Are you in a position to share any of your findings
Well,
so
we
far?
just started. We're working with the Institutional Review Board with St. Francis, getting everything squared away. We want to protect all our participants and make sure that that's appropriate and that's doing the best that we can with that. So we're excited about starting it, though.
Wonderful. So when do you start exactly?
We're probably going to be starting about a month from now.
Wonderful.
The protocol is all done, so it's good to kind of work here. And also with the connections we have with the community here already, we'll be utilizing some of our churches, our clinics, and to really get men in the community 18 and up. So because we want to hear about their experiences with those, hear about those medical experiences.
Wonderful.
And one of the things he's doing, which is not typically done, but increasingly will be done in hospitals, is Lawrence is doing a lot of work right now, our kind of go-to person on mining data that would be insightful from a racial ethnic lens or from a economic lens, or these are things that we're trying to hone in on, and we needed a person who's a good researcher and good data person, and he spends a lot of time going through the data to clarify what we need to do, really getting a good snapshot of where the needs are. That's what he's doing. We always say in health equity, we're looking for who's missing.
Right.
In some ways, that's what we're really doing. It's whether it's a community that's within a larger community that's missing because they're not very vocal or they don't get a splash in the newspaper, or by language they might be missed. And this data snapshot becomes extremely important to capture a story that we would otherwise never find.
And we're utilizing that data around the country because when we first started this, Doc, we didn't have any data in terms of African Americans. We had to go back, I think it was 1960 something, and the data was not updated. It was just like sickle cell. The data was not updated. So what we're doing is that we got our statisticians to give data so we can share with other institutions now in terms of the racial disparities that these physicians, because the physician that I had originally who examined me, he told me to watch and wait. He said, let's wait for a year. And there was a couple of other gentlemen in there. He told them to wait as well. Well, I was kind of proactive, and I went to another physician. So the other two gentlemen passed away. But it was not the doctor's fault, but that's all the data that he had.
Right.
If he knew it was a high rate of death in terms of African Americans based on those particular numbers, he would have treated those patients as well. But his data said that let's watch and wait. Well, watch and wait if it was a Caucasian, but that's the only data he has. So what we're trying to do with people like Lawrence is trying to get some of this data so these doctors can make very intelligent decisions. I spoke of at Harvard Medical School before 250 urologists, and we was talking about different data and different and we found out that 90% of all prostate testing has been done in Scandinavia, and Switzerland. And I don't think there's many African Americans over there. So, and they said sometimes we get so involved with statistics we forget about reality. And the reality is that they must get checked, African Americans at 40. And now the American urologists have adopted that. When you look on the testing who should be tested, they'll tell you African Americans should be tested. Maybe 10 years earlier. So, and these are the type of things that we're trying to bridge because it's not, and if people don't start it, it's never going to happen.
Right.
And so that's what we're trying to do.
Absolutely. That's evidence-based medicine for all people.
Yes.
So you can't practice evidence-based medicine if you don't have evidence or data on the population that you're treating.
Absolutely. And that's another in terms of disparity and inequality.
That's right. I'm Dr. Helen Newton, and I'm your host here on Everything is Health. We are here. We've just spent this time at the Curtis D. Robinson Men's Health Institute Center for Health Equity, and we've had a wonderful tour of the facility and an interview both of Mr. Robinson and Dr. McKinney. We are inviting each person in the community to think about the opportunity that you have here and then reach for the phone and call, make an appointment and come in and be checked. Don't stay at home and ignore any symptoms that you may have. This is something that is open and free for each person, so please pick up the phone and call the Curtis D. Robinson Men's Health Institute Center for Health Equity. We thank you. We ask you to tune in again next week for Everything is Health. I'm Dr. Helen Newton, and have a great day.